Valentine's Day is all about the heart, but today we are focusing on more than just love. Heart disease remains the leading cause of death in the U.S., impacting millions of families every single year. So this morning we are joined by Dr. Garrett Ruth with Lexington Medical Heart and Vascular Center to talk about the steps you can take to keep your heart healthy. Good morning, Dr. Ruth.
How are you?
Good. Also, he told me before the interview started, no relation to Babe Ruth. I know some folks are wondering that. Very cool last name. But I want to talk about heart disease. For folks who may not be aware of what exactly it is, can you break that down for us?
Sure. Many types of different heart disease that we talk about. The most common, I think people would think about is coronary disease, blockages of the heart that lead to poor blood flow, heart attacks. There's different arrhythmias that can occur, different electrical problems that lead to different symptoms, heart failure leading to poor pump of the heart and various symptoms. And then lastly, there can be some congenital heart disease which you're born with, but it can be detected early in age or later in life as well.
Let's look at this. More than 11,000 people have died from heart disease in South Carolina in 2020. Heart disease accounted for over 75,000 hospitalizations in South Carolina. And also, heart disease is expensive. Hospital charges looking at more than $6.8 billion in relation to heart disease. Again, these numbers from 2020. So let's really talk about the prevalence of heart disease specifically in South Carolina. What are you seeing?
Yes, so it's rampant in South Carolina. It's rampant across the entire United States, but certainly in the Southeast we've seen a lot more, whether that's genetics, dietary changes, smoking, you name it, but all of those factors seem to have a more lead to prevalence in the Southeast for sure.
And what are some of the risk factors of heart disease? You touched on that just a little bit.
Sure, yeah. Smoking is probably one of the biggest ones. That's definitely one of the big ones. Diabetes is the next. Those are the big two. But then as you expect, family history, high blood pressure, high cholesterol, diet like we talked about, all of those things increase your risk to have cardiovascular disease as you age through your lifetime.
And what are the symptoms of heart disease, some of the most common ones?
The more common ones, as you'd expect, chest discomfort, shortness of breath, both with exertion. That's when we get really worried as cardiologists, when we hear exertional symptoms. I'm walking around doing things and I get chest tightness and shortness of breath, palpitations, feeling like your heart's beating out of your chest. There can be some atypical ones as well, neck pain, jaw pain, back pain, even nausea and vomiting can be related to different symptoms of heart attack.
Those are so good to know and keep in mind. And finally, my question is this: what can we do to keep our heart healthy?
A lot of things. Obviously not smoking is super important to start, but the basic stuff, watching your diet, trying to avoid those big saturated fat, eating lean meats, plant-based diets, one of the best you can do, fish, all of those things. Getting exercise, just staying active. The AHA recommends anywhere from 150 to 75 minutes of activity throughout the week, but generally if you can just stay active 30 to 60 minutes a day, just get your heart rate flowing, and then obviously see your doctor, see your primary care physician, see your cardiologist. There's various screening tests to be aware of disease that you may not be aware of to get treated early.
All good information there, my friends. And really quick, because we have the doc in the house to say this, smoking also includes vaping.
That's correct.
We've been talking a lot about that, smoking and vaping and not good for your heart. Thank you so much for all of that information. It's so important that we are informed so that way we can make the best decisions to make sure that our heart is healthy and seek help when we need it. We're going to put this interview on our website, WLTX.com, and coming up a little bit later in the show, Dr. Ruth was talking about a heart-healthy diet, and we're going to show you how to do just that. We're going to have some experts in the building to show us how to create a heart-healthy spread.